Hello, everybody. Good afternoon, and welcome to our weekly COVID-19 media briefing with Montgomery County Executive Marc Elrich, also with Dr. Travis Gales, who is our health officer, and Dr. Earl Stoddard, the director of the Office of Emergency Management and Homeland Security. I'm Lorna Virgili, Hispanic Public Information Officer for Montgomery County Government. Reporters, maybe all of you already have permission to record. If you have not received it, please ask for it using the chat, as well as using the chat for the Q&A portion of this presentation. Let me let you know that we have a hard stop at 1:25 p.m. this afternoon, so we need to go swiftly through the portion of the questions and answers. And with that, I toss it to you, Mr. County Executive.
Okay, so thank you everybody for joining us again another week on this call. I promise I will not filibuster till 1:20 so that there are time for questions. So let's get right to where we are right now. First of all, obviously the big news is that yesterday the governor announced that Montgomery County will get its mass vaccination site at the Montgomery College Germantown campus, and that will deliver 3,000 doses per day. This is critical for many of our residents. This is a 7-day-a-week operation, so it's 21,000 doses. I just want to remind people that, like all of the other states' mass vaccination centers, it is open to registration and scheduling to residents outside of Montgomery County. So while I expect our county to get a lot of these vaccinations, the total number will not reflect all county residents. Some of these will be folks from other counties, just as Montgomery County residents have been going to Baltimore, the Eastern Shore, and Prince George's County for vaccines. So this will continue. It's going to open on April 5th. That's the plan. And we're continuing to work with the state to finalize logistics. I want to thank the council, our state and federal delegations, and Holy Cross and Montgomery College for all their efforts in helping make sure that we were able to get this center set up in Montgomery County to help our residents and other Marylanders. It took a joint effort, and I really do appreciate that. And I also want to thank the state for working with us over the last couple of weeks to make this happen. As you know, our staff pointed out last week that the council, they were actually working with the state on this. The governor's formally announced it, so we are good to go. And I do want to especially call out our Office of Emergency Management, our health department, and Montgomery College for all of the work they did. Especially this has been setting up this site at the scale that it's going to be at is an extra effort, and we're really glad to get this behind us and get it done. The county continues its equity efforts. Today I attended the launch of a partnership between Adventist Healthcare, CASA, and the Latino Health Initiative. Through our health and wellness initiative, and they are going to be doing 600 Latinos per week from Montgomery County and Prince George's counties to make COVID-19 vaccine available to communities that have experienced lower vaccination rates and higher death tolls during the pandemic. Last week, I was able to join regional leaders at the event hosted by the Washington National Cathedral that focused on encouraging people of faith to get vaccinated. And I saw Dr. Gareth Murray of the Black Ministers Conference in Montgomery County was there getting his dose at the event, and had the pleasure of meeting Dr. Fauci and Dr. Francis Collins. It was a nice event that was put on, and I appreciated all the effort they put into bringing all these different groups together so they could send the message out to the faith community. Over the weekend, I visited the vaccination site at the Muslim Community Center in Silver Spring. And again, they're doing a great job with volunteers to make this happen. We're launching ads on Black radio stations, including African and Caribbean media outlets, to encourage vaccination. We're working on increasing our outreach to the business community to encourage vaccination of their employees as those eligibility groups expand. It's really important to vaccinate front-facing workers. They are, on the one hand, the people most exposed to other people and therefore most likely to be exposed to COVID-19. And they're also the people who, if they have COVID-19, are most likely to expose other people who come into the stores and businesses to do business. And so, I felt from the beginning that it's critical to get our frontline workers vaccinated, and we are going about doing this. We're making a lot of progress. There's still a lot of work to do. It's important that we continue to push this message out and get those who've been hard hit vaccinated. And I'll remind people that being told you're eligible does not mean that when you pre-register that you're going to get an appointment. We are still lagging. The number of vaccines is behind the number of people who are eligible. So we continue to work through the priorities that the state set. We are following the state guidelines. And as we move through them, more and more people will be getting vaccinated. But be patient and know that with a greater supply, we'll be able to move through groups quicker. We continue to follow the data. I've been analyzing data from the New York Times and noticed that Montgomery County is the only large county east of the Mississippi with a case rate below 10 or at 10 per 100K. There was one county in Missouri, and then the rest of the counties were mostly in California and a couple in Texas and Arizona. But I'm talking about big counties above 800,000 population. So we stand out pretty significantly in what we've done with our case rate. And that's not because of anything special about the air and water in Montgomery County. It's because, one, we set a regulatory framework that maximizes people's safety. And two, we've got residents who understand the importance of public health and the work we're doing and have been working with us and following our guidance. Our report today on cases that we got from the state shows 139 cases yesterday. Our test positivity is at 2.95, and our cases per 100,000 are 10.5. And in perspective of the state, I think today there are either 2 or 3 counties with a lower positivity rate than we have. And there are 7 counties, most of them, if not all of them, small counties that are below 10.5, and 2 counties in the state have moved into the red zone. So we're looking at our trends, we're looking at other trends, and I just remind people that the reason our numbers are where they are, it's not a naturally occurring phenomena, it's a result of policy and people following that policy. I wanted to note that we have always used the data to drive our decisions on not moving as fast as the governor and some of the neighboring jurisdictions. Hopefully that will continue to be our guidance. I think it's worked. I think the numbers say it's worked. And I think that the general, success of what we've been doing is attributable to the policies that we adopted. I know many of you were at the press briefing Monday with Senator Van Hollen about the federal monies from the American Rescue Plan coming to Montgomery County. We are extraordinarily appreciative of their efforts. We're waiting on the Treasury Department for guidance on how this can be spent and what the rules are going to be. But we're ready to do that. We've got an economic development corporation that we've partnered with, and we have always been able to staff up appropriately to handle these programs, and we'll continue to do so. I want to express my concern about evictions. We're getting closer and closer to the point when the moratorium on evictions can end, and we are very concerned. The good news is that there's a lot of federal money and some additional state money coming to us to help residents deal with evictions and for back rent. There's some concern that some landlords may still continue to evict people despite getting back rent, and we continue to be very concerned about that. There is not a lot of housing in Montgomery County that is for folks at the lower end of the economic spectrum. And if they go without housing, finding replacement housing is going to be extraordinarily difficult. So we're hoping that both the state and federal government extend the moratorium. I'm a believer that moratorium has to extend at least a few months beyond the end of the COVID crisis, because it's going to take a while for businesses to reopen and restaff themselves. And so people are not automatically going to be getting paychecks the day that we say that COVID is no longer something we have to carry out these extraordinary measures to protect ourselves against, it's still going to take a while for things to get back to normal. And we have to consider, that it's going to take a couple of months before we can expect a reasonable return to employment. Testing and masking are still very important. We are concerned that testing numbers are dropping all over the state. A few days ago, the state was testing over 30,000 people a day. The last couple of days, the number's below 20. I think yesterday might have been around 12. So the testing numbers are going down. It is critical to identify what form of the virus is present in our community. We know that we have the Brazilian form. We know that we've got the UK form. I believe we've got the viruses from California. They're all a little bit different, and understanding where they are and how much of it is in the county is going to have a lot to do with our ability to control community spread. With spring break and Easter and Passover and the weather changing and things beginning to open up, we know that the opportunities for viral spread will become greater. And so we are just hoping people continue to stay masked and be as careful as you can possibly be. Masking is key, and getting tested is really important to our state of knowledge on this. Only 26% of our residents have received their first dose. So that means 74% of you are still waiting. And those are the folks who obviously are going to be most vulnerable and most exposed. Testing is the best way to ensure that you're not carrying or passing the virus. You don't know you have it until it's too late. So please help us continue to do what you've been doing so we can continue to control the spread of this. And yes, more vaccine is coming. So be patient with that. We still don't know the numbers. I talked with the state yesterday. We know what we're getting for our mass vaccine site, but they don't have certainty on what the numbers would look like for the county or counties going forward. So hopefully it's a lot. Hopefully the Pfizer and the Moderna increase their production as they said they would, and that Johnson & Johnson comes online quickly. I think we got doses of J&J this week, which is the first week since the first week 3 weeks ago when we were able to get J&J doses. So that's my update, and happy to take your questions later.
Thank you, Mr. County Executive. Dr. Gales?
Good afternoon and happy Wednesday. It's always good to be with you, and thank you for the opportunity to chat with you all, and hope you and your families are staying safe. Before I present some data, I just wanted to clarify one thing that the county executive mentioned. We unfortunately haven't received our second batch of Johnson & Johnson doses. That's been discussed, but we unfortunately have not received those yet. So we will let you all know when we get those and how many we get. But I like his optimism. Hopefully he'll speak it into existence, and it will happen sometime this week. I would like to take this opportunity. I know we've had a lot of conversations about vaccines, but to emphasize what County Executive Elrich mentioned, testing is extremely important, and we need to make sure that people continue to get tested, particularly if you've traveled, if you've been around any other individuals who have symptoms or have tested positive, or if you've had any concerning exposure. It's important to get tested to know your status so that we can identify you if you are positive and remove you from any potential networks of transmission. So if you'll indulge me a little bit, I'd like to share a couple of slides that highlight the numbers in terms of where we stand today versus where we were on March 8th, which happens to be my father's birthday, and also the date that the governor made his announcement to open up more provisions across the state. All right, so if I was successful, you're looking at a PowerPoint slide with cases per 100,000 residents. All right, so this is a schematic. Actually, this is as of Friday. Our case rate has actually increased from 10.33 to 10.55 this morning, which technically by CDC definition meets the criteria for higher risk of transmission. But fortunately, it has been, more stable than the state, for example. In point of comparison, on March 8th, the state's case rate per 100,000 was 12.6. It was 16.46 this morning. Now, the other two measures that I want to show you are the test positivity rates and the case rates per 100,000 in comparison to looking at county by county. I know the graphics will be a little small, so I'll try to highlight the important things. So this is looking at the test positivity averages, 7-day averages, when on March 8th, when the decision was made by the governor to open up things more extensively. At that time, the state test positivity was 3.36%, and no counties across the state were over 5% test positivity at that time. So again, just point of reference, and you can see us at 2.73. So keep that in mind. And the next slide I'm going to show you average, 7-day average is 4.59. We now have 11 counties across the state who are over 5% in terms of their test positivity. We at Montgomery County are at 2.95%, which is a slight increase for us, but as you can see across the state in comparison to where we were 2 weeks ago, the numbers have increased for a host of counties, both larger counties, including Anne Arundel, Baltimore, and Baltimore City, as well as smaller counties, including Kent County, Dorchester, Queen Anne's, Washington County, etc. Also, just want to show you in terms of the trajectory of how we've moved forward as a state and how we're doing on a local level. And it's important to highlight that, again, we are one of the counties that have taken a more restrictive in comparison to the state level of restrictions, which I think is in large part responsible for why our numbers have not increased at the rate that other jurisdictions have. And this is not a blame game or a beat our chest. This is just stating where we are in comparison to where we were 2 weeks ago. And this underscores the guidance that we will provide to the County Council's Board of Health as they move forward in terms of necessary actions. So this slide represents it's a color-coded slide that I think is quite impactful, that shows where the different jurisdictions were on March 8th. And the lighter yellow shows case rates below 10 per 100,000. And the orange is 10 to 25, and the pink or red, purple, depending upon how it looks on your screen, represents those greater than 25. And at that time, the state case rate per 100,000 was 12.6. There were 0 counties over 20 cases per 100,000 and 13 counties that had case rates over 10. When we move to today's map, you can see some differences. We see 2 jurisdictions now in the red zone. This is Baltimore City and this is Kent County. And the state overall case rate per 100,000 is 16.46. And we have 18 counties now who are over 10 cases per 100,000, including Montgomery County. And we have 4 counties that are actually over 20 cases per 100,000, including an additional one in Harford County, which is at 19.74. So I will stop there, but just wanted to provide some context, again, where we stand in terms of community transmission levels. This does not include any hard numbers from the state related to variant cases, but we do suspect that those numbers are going up. As the county executive mentioned, we in Montgomery County have reported cases of all of the variant strains, UK, Brazilian, South African, as well as multiple strains of the California variant as have been defined by the CDC. I will stop there. Happy to answer any questions that you all may have. Dr. Stoddard.
Thank you, Dr. Gales. Thank you all for joining us again. I just want to touch on a couple things that we're doing over the next couple weeks to get the mass vaccination site ready with the state. We actually did a site visit with the National Guard again this morning, and we'll actually have meetings this afternoon with Maryland Department of Health on various issues between the registration system the state utilizes, as well as staffing and other things that we're getting support on from the state. We'll continue those preparations. We are looking at a whole host of opportunities in terms of, transportation options to get people to the site, how the site will be, what security will look like at the site, how traffic will flow through the site. So There is a lot of work for us to do over the next several weeks to get this site ready. It's not something that you just take the key to this door and you go in and you start operating. And I would imagine that we're going to, ramp up from the beginning, and the site will look potentially different from the first day we operated to when we reach our peak. And so we've got a lot of work to do, and we'll be working very closely with the state and our county partners, as well as Holy Cross Health and Montgomery College, to make this site be successful. I think that, obviously, a lot of things to be determined. So some of your questions we may not be able to answer around particularly things like, well, how can a resident register for the site today? Obviously, we have to figure out exactly what the ratio of how many people will be drawn from the county's pre-registration list versus how many will be coming from the state. Mass vaccination pre-registration, all those things are sort of to be determined in our partnership with the state still. And so we look forward to being able to reveal some of those details over the coming days and weeks as we get ready to operate the site in a couple weeks. So I'll stop there and happy for us to answer some questions.
All right, thank you, gentlemen. Let's get started with the questions. Remember, hard stop at 1:25 this afternoon. And the first question is from Randy Baz with WDVM for the county executive and also Dr. Gales. Randy?
Good afternoon. Thanks so much for having me on the briefing. As always, I appreciate you taking my question. To detour from COVID for just a brief moment, and I'll let us get back to COVID news. County executive, we've seen another Democrat declare their candidacy for the county executive position for the 2022 election. A lot has happened since 2018. I just wanted to confirm that you are still planning to run for re-election next year. And
Absolutely.
And I guess, how are you feeling heading into another election? I can't believe it's time again.
Look, I'll be honest with you. I haven't thought about the election. We haven't been doing planning for an election because I'm focused on trying to get us through the end of COVID. That would be a distraction for the moment. There's plenty of time for electioneering, but I feel pretty strongly that I didn't want to launch anything or do anything significant that was campaign related in the midst of dealing with this. So I'm perfectly comfortable and I will be running.
Thank you very much. And Dr. Gales, yesterday we saw the Board of Education move up the MCPS reopening timeline. Just kind of wanted to get your reaction to that and see if you could touch on some of the outbreaks and cases we've been monitoring throughout MCPS.
Sure, thank you for the question. So we have provided guidance to the board as well as our MCPS colleagues in terms of what steps to take and what metrics to look at. And so we certainly feel comfortable and confident that they have, consistently taken heed of that guidance that we provided and continue to use those strategies as they move forward in terms of reopening. One point that we didn't mention here is that we feel better about reopening given that our teachers and education staff across the board have at least had an opportunity to be invited to get a vaccine. As part of the county apparatus, including those efforts in partnership with Johns Hopkins, we have sent registration links to over 26 or 27,000 members of MCPS, which would encompass all of the full-time staff, and have been working to make sure that temporary staff or substitutes or other folks within that pool also have had a chance to get covered. And so we will continue to work with them and provide guidance around that as we continue to move forward within those spaces. And I believe, was there a second part of your question that I missed?
Yes, thank you. Just kind of wanted to see if you had any updates on case counts and outbreaks we might be monitoring at some schools.
Sure. And sorry, it's been a long day already. So to that, we have had, I believe, a number of cases where we've had individual cases involving schools. I want to say there's been 14 to 15 of those where we have been fairly confident that it has been household or community contact as opposed to actual school involvement. We have had multiple many outbreaks involving some of our sports teams within multiple schools that have involved multiple sports and athletics based upon exposures with potential exposure related to competition. We'll need to continue to investigate that, as well as outside exposure due to practicing or those types of activities. I want to say there have been at least 2 of those where we've had to quarantine a subset of multiple student athletes within that, and 2 other instances where we have had to do contact tracing within that setting, but not a significant quarantine as we've had in those other 2 instances.
Thank you both very much.
Thank you, Randy. Next question, Jordan Lindsay, my MC Media. Jordan?
Great. Thank you so much, guys, for hosting this. I truly appreciate it. When we're talking about the mass vaccination site, I know things are still moving with this, but you said there's 3,000 doses per day is what you guys think is going to be happening there. Where will these vaccines be coming from? And I know, Dr. Stoddard, you said this is still in the works, but being that there was limited supply before, where will these come from? Because there was a shortage. And how will it impact other sites in the county? Will some be closing and things like that?
Sure. So the details that we've gotten from the state so far is that just like the other mass vaccination states across the state, this site will have its own earmarked allotment pulled off the top of the state's allocation. What we'll likely we're partnering with Holy Cross Health to do is Holy Cross Germantown's site will be registering as a vaccine recipient site, and will likely receive the full allotment that's given on a weekly basis to the site. And since it's on the same campus as Montgomery College, Germantown, it obviously makes good sense to do that. The vaccine overall, I think the governor talked about this in his press conference on Tuesday. He mentioned that there's an impending increase from the federal government that is coming. And I suspect a significant chunk of that increase will be used over the coming weeks to fuel the site at Montgomery College and in Baltimore County, and then the additional sites that will come on board thereafter. I think the governor referenced something like the state being up to like 350,000 doses a week once that increase starts to happen. And I would expect a significant chunk of them, and so obviously our site would be somewhere in there of 20 to 21,000 for that to support a 3,000 a day site. And so it will be a separate pool. It will not come out of it will start as a county site, to be clear, just as in the ramp up process, and will come from our current 8,000 a week doses. But at a point, it will transition over to a separate pool that the state will give us that is for the state site. Will incorporate all state residents, not just Montgomery County residents. And at that point, it will no longer come from our pool of vaccines separated from Montgomery County, and that will still continue to go to other places. And I think I'll let Dr. Gales talk a little bit about the other sites and what you're likely to see with those.
Well, I would just add that consistent with how we've approached this before, is we are obviously excited to be able to have a large scale site such as a mass vac site to be able to get thousands of people through the queue on a daily basis. But what we also want to continue to emphasize is that the mass vaccination site can't be the only source of additional doses, as we know that not everybody within our community has access to those sites. Now, we will, as Dr. Stoddard mentioned, we will do everything we can to remove those obstacles as best as we can, but we also recognize that we have to continue to build up the infrastructure that we have in place in terms of having multiple venues that folks can access, including additional large community sites consistent with what we are doing now, as well as increased partnerships with our community partners to provide even better access deep within the community to take advantage of their footprints and their relationships with their clients through their regular clinic hours, as well as their outreach efforts through other organizations. So we look forward to utilizing the increase in doses to be able to support those. As you know, we've had some pop-ups already that we've supported, and we look forward to using the best practices from those to be able to move those forward to, again, give folks as many options as possible so that we can get them vaccinated and covered.
One quick additional question. How many sites total will there be when this mass vaccination site opens, including the mass vaccination site in the county? How many vaccine clinics will there be once it opens on April 5th?
That's still to be determined because, as you know, we'll have the MassVac site. We anticipate we'll have multiple sites that we have similar to what we have right now at Quince Orchard and Richard Montgomery High Schools. And we look forward to increasing that in terms of being able to provide doses to our community partners. The hope also is that as the number of doses to each jurisdiction increases, that private providers will also have access to be able to request their own doses so that they can also provide opportunities for their patient portal as we move forward. So to be determined, but stay tuned.
Thank you.
Thank you, Jordan. Next question is from Tom Fitzgerald, Fox 5 DC. Questions for the county executive and also for Dr. Stoddard. Tom.
Hi, everybody. Thanks as always for doing the call. County Executive, I want to just spin back to Randy's question just for a moment.
Yeah.
You said you weren't thinking about, re-election right now. You have your hands full with COVID, but clearly some other people are thinking about this. Mr. Blair this morning in his announcement wrote that he feels more concerned than ever and that the county deserves strong collaborative leadership. I guess my question is, I think it was exactly a year ago that you were on the Sunday program with us and we didn't know what any of this was going to be. At the end of the day next year, do you feel you're going to be judged on your COVID response? Are you comfortable with that? And could it theoretically cost you your job?
I'm comfortable with our COVID response. I think that, the data will show, pretty clearly shows that we've been able to minimize the damage to human health in this county to the extent you can minimize anything. And I think that, when I talk to people, the overwhelming response I get is that they wanted to feel safe and that we've helped them be safe. And I think that's a good thing. I think that, I understand the difficulty that some businesses have had. This is not something that we've ignored. We've been supportive. We've gotten money out. We are prepared with the new federal money coming to help make sure we distribute even more of it out to the business community. But from my view, and I think, from the health view, our responsibility was to keep people alive. And we set out to make sure that as many people be around when this is over to celebrate as possible. And I feel pretty good about what we've done. And like I said, I think our numbers kind of speak for themselves.
If I could just follow up on that, a lot of times elected leaders, you want to tell people good news. You want to tell them good things. You've been over the course of 12 months now having to tell people a lot of not good things sometimes. Does that hurt you?
No, I think people actually appreciate somebody being honest with them. I mean, telling people that, oh, you're going to get vaccinated. It's one of the biggest concerns I've had about the pressure to tell good news is that it raises expectations that inevitably no one's able to meet when everybody thinks they're eligible and then they discover that they could still wait 3 months to get a vaccine and they can't even get scheduled. That creates problems. I think, being as realistic and honest with people about what it is we're dealing with and what we're doing and why we're doing it. I mean, I've spent a lot of time with you all talking about why we make the decisions we make, knowing that you will, get some of this information out into the community. So I think, not always being the bearer of good news is part of being an adult and part of being responsible. And I think we've been responsible about that. And I feel like I've been responsible about that.
All right. Thanks for your answer. Dr. Stoddard, if I could, I understand this only got announced yesterday. The governor had told us last week that these talks were underway. Can you give us an idea of the magnitude of the logistics that are involved with this? I know we keep saying next month, but that's it's going to come up quicker than we realize. How big of a job is this standing up this mass vaccination site?
Well, I can give you a sense of the scale. So the state estimates we're going to need about 130 people every shift that's operating at the same time. Obviously, when you talk about 3,000 doses a day, that's, getting 400 to 700 people through there every hour, over and over, hour after hour, while also considering how are you going to be able to meet the people who have mobility needs. Obviously, we still have a portion of our 65 and older population We're just getting into the phase where we're talking about people with underlying health conditions. Many of those are significant and may require modifications to our process. We're trying to get transportation set up between our various transportation hubs across the county, because we know that this isn't going to be a drive-up site. This is going to be a walk-through site, which means we need to get people to the site. Oh, and by the way, even at drive-up sites, some people don't have cars. Some people don't have transportation that they can just hop in and get to. We have to make sure it's equitable. We've got a community in Germantown that's one of our higher top 10 zip codes. How are we going to make sure that residents in the area that it's serving are going to be able to benefit from the site? And then, obviously, like signage, like most of our sites right now are meant to be set up for county residents. We're going to have residents from Frederick County and across the state. So where are we going to place signage around, not just, near the site, but along the highways and things to help people get there? And so there's a lot of logistics questions, a lot of details to work out. We've got a team of probably about 40 people across multiple agencies working on this right now. That's not even the people who will be doing the vaccinations, and our fire department, police department, transportation, general services, IT, technology, Montgomery College. I mean, it is a broad swath of both county government, Holy Cross Health, and Montgomery College. And then every one of those agencies has a state counterpart that they're working with too. And so it is layering a significant amount of challenge just to make sure that we can, we've gotten pretty good about getting vaccines in the arms at the sites. I mean, obviously, the Quince Orchard and Richard Montgomery sites have done 1,500 plus vaccinations in a day. So we've got a lot that we've learned from, but obviously we just layer on some challenges when we talk about residents from across the state, new registration systems, wanting the site to be, it's a bigger site. So there's just, take everything that we had to do. You might just say double it, but in some places it's more complex than that.
Thank you.
Thank you, Tom. Next question, Kate Ryan, WTOP, and questions for you, Mr. County Executive, and also Dr. Stoddard. Kate.
Thank you very much. I have a bunch of questions. I'll try and keep it quick. Has the state committed, I know you've talked about earmarks, has the state committed to the 3,000 doses for the MassVax site? And does that MassVax site, I want to be absolutely clear, it does not absorb what you had going on at Richard Montgomery and Quince Orchard. Other locations have to be found for the folks who are getting vaccines there, correct?
I will leave that for Dr. Stoddard to answer.
Yeah, so the state hasn't said exactly that we'll get 20,000 doses starting on April 5th or April 15th. I think they're waiting to see this ramp up too. They have agreed that 3,000 doses per day is the target throughput for this site, and they agree that it should be a 7-day-a-week site. And so combining those two things, that tells you 21,000 doses a week as a target goal. Now, I think they've been, I don't want to say coy, because I don't think it's being coy. I think they've been not willing to say on this date this much vaccine, because they want to see the shipments come in from the federal government. I do think, and this is what I alluded to, this will come off the top of the state's allocation, just as the currently operating 5 sites right now, us and Timonium will be 6 and 7. As those sites are all operating, that will come right off the top of the state's allocation before it subdivides and does pharmacy and all these other things. And so I would expect that they'll be able to meet the need as the target from the federal government ramps up. Obviously, we are extremely hopeful and confident that the Biden administration is going to come through with their pledge to rapidly increase doses. But in order for the state to commit to it, they have to see the doses from the feds. What was the second part of your question?
Richard Montgomery and Quince Orchard. Yeah. This new site does not take the place of those, right?
Correct. So the supposition would be, let's say we stay at 8,000 as Montgomery County. We would have to do 8,000 through the other sites, not inclusive of the 20,000 a week that we're doing at the state site, Montgomery College.
Do we know where those will be?
Yeah, so as I mentioned earlier, there's a constellation of different sites that we will be announcing starting next week as we transition out of those spaces. It will include a combination of county sites, potentially recreation centers and spaces. They won't be schools. but we want to make sure that they are geographically spread across the county. Additional doses will go to support community partners and community clinics to be able to also stand up clinics that are open on a routine basis. And we hope to also be able to continue to expand our other efforts around mobile vaccination, again, particularly for those who are homebound and aren't able to access any of those sites.
Okay, and on the mass vaccination site, remember, Dr. Stoddard, you'd said, we're going to set it up to show that it's viable, you know, before we got this commitment and announcement yesterday, starting next week. Are there going to be vaccines available to people at Germantown next week? Or do they have to wait till after April 5th?
You
have to wait. Yeah, go ahead, Dr. Gill, sorry.
We'll be transitioning, as part of that transition from the high schools, we will be transitioning, and we don't have the definitive date, but we expect that early next week, potentially Monday or Tuesday, that we will have that up and running as another site that we will be providing doses consistent with what we've been doing so far, as we continue to map out and plan out the additional things that need to be put into place for the mass vac site to be up and running when we hopefully get this still to be determined amount of doses from the state to support it.
Got it. And then 65 plus, I know at some point we were at 70% of those 65 plus had been vaccinated. Do we know where we are now on the 65 plus population?
I'm pulling up as we speak, and I can give you an answer.
Yeah, we're pulling up the
It's a race.
slides.
I thank you.
Go for it.
72% as of this morning.
Okay, so still pushing through. And lastly,
And
yes,
so let me clarify that. 72% of 65 to 74 and 78% of 75 and above. So I think you split the difference there. It's probably about 75%.
got it.
That's
And then
first dose.
First
okay,
dose.
and yesterday, Dr. Marcosi, advisor to the governor, was talking about the variant known as B117. I think that's the one people refer to as the UK variant, although we're not using locations because people don't like that. But he talked about that is hitting more younger people and that it seems to be more gastrointestinal, if you will. Dr. Stoddard, are you seeing that? And is that a particular concern among younger people as we hit things like spring break and people more outdoors and once kids are out of school for the summer?
So I'll actually address that. So yes, we are seeing, we're getting increases in those reports of the B117. I won't name it by geography, but you're correct. We are seeing an increase in those cases. We aren't seeing it at least translate to hospitalizations and fatalities at this point. But consistent with, I believe, Michigan announced today that they've seen a 105% increase in the number of cases of those who are 10 to 19 years old. So certainly, given that those groups are not getting vaccinated due to the prioritization and risk scheme, we know they are at increased risk. And again, we want to emphasize to folks is that just because we have vaccines out does not mean that folks are any less susceptible to coming into contact with it and transmitting it. And it underscores the importance of folks continuing to adhere to the public health guidance as they think about traveling or they think about mingling and interacting with others during the spring break periods, and underscores again the importance of getting tested after those activities stop and they come back to the local jurisdictions and enter back into work, into schools, and those kinds of places.
Got it.
I certainly think Europe is really we're learning a lot about these, particularly the 117 variant that we talked about from what's happening in Europe. And there are certain countries in Europe, I think Belgium in particular, where it has struck their younger population in a significant way. And they have talked about the impact of some of the interplay between education and parents of students in education and that particular variant. And so, I think right now as a country, we're running about even in our race against the variant spread versus vaccination. Some places are ahead of the variants and some places are behind the variants. And obviously, the more we do to reopen, the more we assist the variants in their ability to win that race. And that's why I think, as the county executive said, we want to be tempered. I think we can agree that we should be reopening. I think everyone agrees with that to an extent, but it has to be measured and it cannot just be, we can't go full throttle, as it were. knowing that the variants, we don't want to help them in winning this race. The governor's actually used the term, the race, so I think he recognized this too, is that we want to win the race against the variant spreading versus vaccination. Key to that is making vaccines more rapidly and readily available, and we definitely are supporting that, obviously, as we talked about. But concurrent to that, we want to keep some of the mitigation practices in place for a little bit longer, to the point where we allow that surge in vaccinations to help us win the race before we substantially reopen, and at which point the variants will have less impact once we have so many people vaccinated.
Got it. Thank you very much.
Thank
I
you,
just
Kate.
wanted to circle back, sorry, Luna, just to clarify one thing and getting a text from the team. So the Germantown site that will be supported by the county will be up Monday through Friday next week. We anticipate offering approximately 1,500 dose opportunities a day beginning Monday.
Thank you.
Thank you, Kate. Thank you, Dr. Gales. We have a couple more questions from Rebecca Tan, and there's also a follow-up regarding the variant cases in Montgomery County from Brianna Bethesda Beach. So let's go with Rebecca Tan, 117, hard stop at 125. Rebecca.
Thank you. I have two questions for Dr. Gales and Dr. Stoddard. First for Dr. Gales, just so I understand from the analysis that you did for all of us, are you saying that the statewide steps toward reopening has prompted an increase in coronavirus transmission in the past couple of weeks, or do you think that there are other factors at play here?
Well, I think just from a strictly objective standpoint, you look at the numbers since that decision was made to open things up, increasing capacity to the level it did. We've seen an increase in cases per 100,000, increase in test positivity. And I do think that has factored into that. And when you look at, for example, where we made the decision to stay where we are, our numbers have not had a similar trajectory as those other jurisdictions. So it is extremely concerning. And when you layer that with the conversation around variant strains, and I know Brianna's question is related to this, so hopefully this answers it. We have seen multiple strains, and I because I don't have the specific labels in front of me, I will use geography. We have seen the strains of the UK variant, the South African variant, the Brazilian variant, as well as 2 variant strains identified as part of the California variant set of variants within that.
But I also say, Rebecca, it's sort of complicated to try and separate these things out. One could say, well, it's because more variants are spreading. That's why we've seen this increase in cases. Well, more variants are spreading because we've opened more things up and there's more spread. And sort of like, that's why there's an interplay between these dynamics. And I think it's just important to understand that you can't it's impossible to separate specifically one variable from another in many of these cases where it is complex, but the factors aren't individual variables or isolated variables. They interact with one another.
Got it. But even in Montgomery County, where it's taken a more cautious approach, we see the case rates sort of plateauing for the past month or so. Why is this the case? Why aren't case numbers going down as more people get vaccinated?
Well, I think a large part of it is we're not in a bubble. So we have people going back and forth across all parts of the state to work, to play, for commerce, to eat, to shop, and do all those things. So even, this is why we've tried to encourage a regional and state approach, recognizing that, we can only control so much within our jurisdiction, and we would be influenced by the actions that the state has taken in other areas. So I think that is one component of it is, we're not in a bubble. When you look at other countries who have been, I guess, more successful, if you will, in terms of being able to control COVID, I think of Australia and New Zealand, for example. They had tighter restrictions in terms of who could come and go within their country. And they took, very strict actions when they saw marginal to medium increases in those same transmission numbers that we measure here. But they were able to put a bubble, if you will, around their community and drive things down.
Got it. And my last follow-up question for County Executive Elrich, if we see cases in Montgomery County start to increase on a consistent basis, is the county prepared to, reimpose some of the restrictions that have been lifted?
Well, that's, obviously now a decision for the Board of Health. I would hope so. I would hope that, we just don't decide that we're going to let this thing run wild and cause as much damage as it can possibly cause before we've managed to get it under control with vaccines. I mean, it's frustrating because we're so close. I mean, what are we, 13 months into this thing already? We now know there are vaccines. We know the vaccines are going to come here. We can debate whether we finish the job by, the end of May or the end of June, but there's certainly a short-term path to getting this done. Maybe, like I said, you could debate whether it's the end of May or end of June. We're pretty much done. Why we would increase the risk to people when we can actually get this thing over with, that would escape me. I think this is our opportunity to say, let's finish this. Let's do the job we set out to do. And so I worry about, lightening up on it, because you can look at the maps and you can see where things lightened up. And unless you believe Montgomery County exists in a magical bubble and is somehow immune from all the other things that are affecting everybody else, you'd have to conclude that there's probably something to be said for being more careful about this. The other thing I'd add just about, vaccinating people. In my mind, it would have been helpful if we had focused on the people who are most likely to get COVID from their work and most likely to expose other people in their work. And that, many people are getting exposed, not in their homes and not walking down the block, but when they go and interact with people. And so, to my way of thinking about this, one of the key factors in getting this under control is getting the frontline workers vaccinated, so that when they come in contact with people, or when they're in a room for an extended period of time, that they don't come down with COVID, they don't bring it back to their communities, and they don't spread it among the people coming into the businesses. But I feel pretty good about the trajectory we're on, and I think patience, and this will be done with. And like I said before, there'll be more of us around next year to celebrate having gotten through this.
Got it. Thank you.
All right. Thank you, Rebecca. Thank you, Brianna. Thank you, reporters. And thank you, Mr. County Executive, Dr. Gales and Dr. Stoddard. It is 1:23, I believe, and we're going to wrap it up. Thank you for joining us, and we'll see you again next week. Have a great
Thank you.
afternoon.